Dr. Limongelli, have you ever made appliances for, people playing football, soccer, and other sports, mouth guards for children?
Yes, I have. And the mouth guards work very well. As a matter of fact, anybody that engages in sports of any kind should wear one. Basketball, if you get an elbow in the mouth, or football or boxing, they all should wear mouth guards. And there's different types of mouth guards that you can get. One is a soft mouth guard, which for low contact sports can be used, and one is a hard mouth guard, both of which are custom designed, made from impressions or molds of the mouth. The hard mouth guard is very good for heavy contact sports like football and kickboxing and boxing and things like that. It does prevent injuries to the teeth and gums. If you get a tooth knocked out, it becomes a problem to reimplant it and deal with it. The best treatment for something like that is prevention, and a mouth guard is the best appliance to have.
Now let's talk about wonderful. So you mentioned if you get a tooth knocked out, and I remember having once talked to a dentist who happened to have walked by on the walkway, and a kid boarding was knocking out a tooth. And a whole little crew of 4 or 5 people, because the dentist walked by, he instructed everybody to look for that tooth. They found the tooth. They brought him to the very nearest hospital, and that particular dentist who was helping to look for that tooth implanted it within, whatever it was, a half an hour. Because if you do it very fast, find the tooth, implant it very fast, then it has a chance of regrowing, and apparently this tooth did. So if a kid gets his tooth knocked out, should he just grab it and run to the dentist, or should he just, is that a good thing to do?
Yes, and the most critical thing is to keep the tooth wet, to wrap it in a wet handkerchief, or if that's not available, to put the tooth in the mouth, and the saliva of the mouth will keep the tooth wet. As long as the tooth is kept wet and the periodontal ligament around the tooth is prevented from drying, it carries the highest success rate. If you go to a dentist, he'll reimplant it for you, put a little splint around it to hold it in place, and usually within about 6 weeks, the splint can come off, and the tooth is back into its socket and tight again. Probably the only thing you have to worry about after that is whether the tooth in time will need a root canal or not. If it does, it can be diagnosed by an x-ray and also by symptoms, whether the tooth becomes painful or not. If it requires a root canal can be done by the dentist, and the tooth can still be saved.
Wonderful. Very good information. So basically we should do that. Does that hold true for all people, like children, teenagers, adults, or...
Yes, age is not a barrier. Keep the tooth wet, and it has the highest incidence of success when reimplanted.
Gorgeous. Wonderful. Well, thanks a lot, Dr. Limongelli. Interesting talking to you about those things.
A pleasure as usual.